Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Diagnosis of pelvic inflammatory disease. We have minimum criteria and specific supportive criteria. In minimum criteria, any one of the following should be present. 1. Uterine tenderness. 2. Cervical motion tenderness. 1. Uterine tenderness. Second, cervical motion tenderness. Third, etnaxial tenderness. So among three, at least one should be present, which is minimum criteria. Second, supportive criteria. In supportive criteria, fever should be more than 106 degrees Fahrenheit or more than 86.8 degrees Celsius. There will be raised WBC count, raised CRP, and there is abundant WBC in the discharge. The lab tests positive for gonococcal and chlamydia. So um, these are the supportive criteria. The lab tests which are done for gonorrhea and chlamydia include: for gonorrhea, the investigation of choice is nucleic acid amplification test, and the sample for gonorrhea is endocervical discharge followed by urine sample. The uh, gold standard investigation for gonorrhea is culture, that is Thayer Martin culture medium. And for chlamydia, the investigation of choice is polymerase chain reaction or nucleic acid amplification test, whereas gold standard is culture with McCoy culture medium.
For chlamydia, it is better to do PCR, and gold standard is culture with McCoy culture media.
thank you and thank you for watching.